Have you ever wondered what the final moments of life really look like? These 12 warning signs might surprise you. Some are subtle, others unmistakable, but they all tell a story that most people don't recognize until it's too late. Stay with me because understanding these signs could change the way you view life, love, and the moment of saying goodbye forever. If you want to discover the truth and learn what to do when these signs appear, watch until the end. Don't forget to like this video, share it with someone who needs this message, and subscribe to stay informed about the life lessons we all learn. Let's begin, because this knowledge is something everyone should have before it's too late. Signal number 1: decreased appetite and thirst. One of the first signs that 90% of people don't recognize is decreased appetite and thirst. When the body begins to prepare for the end of life, it naturally reduces the need for energy and hydration, prioritizing essential vital functions. This can manifest as difficulty swallowing or simply a lack of interest in eating and drinking. For example, Maria, an 85-year-old woman with advanced heart failure, stopped feeling hungry and began rejecting her favorite foods, even light soups she once enjoyed. Her family became concerned when they noticed she was drinking less water and seemed weaker. After consulting with her doctor, they learned that her lack of appetite wasn't just a symptom of her disease progressing, but also mild dehydration. To help her, the doctor suggested offering fluids in small amounts, like warm infusions and oral rehydration solutions, along with easy-to-swallow foods like purees and jellies. Though her appetite never fully returned, these changes improved her comfort and maintained some hydration. It's important to note that in such cases, consulting a doctor is crucial. They can determine whether the decreased appetite and thirst are reversible or part of the natural end-of-life process, ensuring the person receives the best possible care at this stage. Signal number 2: reduced energy and weakness. The reduction of energy and weakness are common signs that death may be near. Imagine the body like an efficient machine beginning to conserve its last energy reserves, leaving you constantly tired and unwilling to perform even simple tasks, like getting out of bed or taking a brief walk. This persistent weakness affects not only the body, but also generates feelings of discouragement and isolation. But there is hope. In many cases, this energy decline can be reversed with proper care if the cause is treatable, such as anemia, dehydration, or nutrient deficiency. Appropriate medical interventions can restore energy levels. This includes administering vitamin supplements, maintaining adequate hydration, adjusting medications, or starting specific therapies to address the underlying issue. If you find these stories inspiring and motivating you to take action, please comment 9. If not, comment 0. Your opinion means a lot to us. Thank you for your valuable time. Signal number 3: drop in body temperature. A drop in body temperature is a sign that the body is reducing blood circulation, which can make you feel cold and have pale or even bluish skin, especially on the hands and feet. This decrease in temperature is a natural response when the body tries to conserve energy for vital functions, but it can cause discomfort and unease. However, in many cases, this temperature drop can be reversed. If the cause is treatable, such as infections or metabolic issues, simple measures like covering with extra blankets, taking warm baths, and drinking hot liquids can help restore body temperature. Signal number 4: changes in urine and kidney functions. Imagine that as the body prepares for the end, the kidneys, responsible for filtering the blood, begin to function less effectively. This can manifest as 1. Decreased urine output. Less urine is produced, or urination occurs less frequently due to reduced kidney function. 2. Darker urine. Urine may become more concentrated, taking on a dark yellow or brown color, indicating possible dehydration or kidney failure. 3. Foamy urine. The presence of proteins in urine can cause foam, which may indicate kidney damage. 4. Fluid retention. The body may retain fluids, causing swelling in the feet, legs, or abdomen. 5. Reduced nighttime urine production. Urination during the night may be significantly reduced. 6. Pain in the kidneys. There may be discomfort or pain in the lower back near the kidneys. Additionally, fluid retention and reduced urine production are common, reflecting the body's attempt to conserve energy to maintain vital functions. While some changes in kidney function can be reversed with appropriate medical interventions, it is essential to identify the underlying cause and act quickly. Therefore, if you or someone close to you shows signs of kidney problems, it's important to seek immediate medical attention. If you find these stories inspiring and motivating you to take action, please comment 9. If not, comment 0. Your opinion means a lot to us. Thank you for your valuable time. Signal number 5. Changes in mood or behavior. When a person begins to display sudden alterations such as increased irritability, anxiety, or even depression, something more serious may be happening. These changes can arise due to physical factors, such as hormonal imbalances or chronic pain, or due to emotional processes that naturally occur as death approaches. In some cases, there are reports of individuals mentioning that they are preparing for a trip, even packing suitcases. If you notice that a family member or friend is exhibiting this kind of behavior, don't hesitate to seek help. In certain instances, these alterations are reversible and treatable. Interventions may include antidepressant medications, adjustments in painkiller doses, supportive psychological therapies, and the creation of a peaceful and welcoming environment. Signal number 6. Decreased sensory functions. This signal can manifest as partial or total loss of hearing, vision, taste, and touch. This happens because the body is reserving energy for essential functions like breathing and heartbeat, which can make you less aware of your surroundings. This reduction may lead to less interaction with the environment, generating feelings of isolation and confusion. However, the good news is that this symptom does not always signify the end. In many cases, the decrease in sensory functions may be due to treatable causes, such as vitamin deficiencies or infections. That's why it's important to keep up with your medical checkups and repeat them if you notice anything unusual. Signal number 7. Alterations in consciousness. As the body and mind begin to prepare for the end, it is common to observe changes such as excessive sleepiness, mental confusion, disorientation, or even periods of lucidity interspersed with moments of unconsciousness. These alterations can be caused by chemical imbalances in the brain, lack of oxygen, or infections. A 78-year-old woman who was facing advanced cancer shared her experience during her final days. She described moments of deep sleepiness, waking briefly to notice she was surrounded by family members, only to return to a state of almost meditative tranquility. At times, Maria had episodes of confusion, forgetting recent conversations or the names of some visitors. However, she also experienced moments of surprising lucidity, expressing feelings of peace and gratitude even while being aware that her time was coming to an end. If you find this inspiring and motivating to take action, please comment 9. If not, comment 0. Your opinion means a lot to us. Thank you for your valuable time. Signal number 8. Changes in breathing. As life approaches its end, changes in breathing become one of the most obvious signs of this natural process. It is common to observe a cyclical breathing pattern, where moments of rapid breathing alternate with silent pauses, known as Cheney-Stokes breathing. Additionally, breathing may become more shallow and slow, with longer intervals between each breath or episodes of intense effort to breathe, known as agonal breathing. These alterations occur because the body, exhausted from daily battles, begins to reduce its essential functions, focusing its energy on the final vital processes. Unusual sounds, such as soft moans or wheezing, may also accompany this delicate moment. For those accompanying a loved one, Recognizing these signs can bring a deeper understanding, knowing that the body is gradually preparing for its final stage and respecting the natural rhythm of life. Signal number 9. Sensation of detachment. For those experiencing this process, there may be a gradual perception of disconnection from their own body, accompanied by a diminished awareness of the surroundings and a sense of lightness or floating. Physiologically, as brain functions begin to slow down due to decreased blood flow and oxygenation, perception and consciousness also decrease, creating this experience of detachment. Psychologically, there may be a release of accumulated tensions and a calm acceptance of the inevitable, generating inner peace and a distancing from everyday concerns. Additionally, chemical changes in the brain, such as the release of endorphins, can enhance this sense of calm and detachment. For family and friends, understanding these signs can help create an environment of support and serenity, recognizing that the loved one is going through a natural and dignified transition. This sense of detachment, though delicate, is part of the cycle of life, facilitating a more harmonious and conscious transition to the moment of farewell. Signal number 10. Difficulty communicating. As people approach the end of life, they may experience a gradual decline in their ability to communicate. This symptom, though often subtle at first, can become more pronounced over time, indicating that the body is beginning to shut down. Communication, which we often take for granted, involves a complex network of physical and mental processes. When these start to deteriorate, individuals may have difficulty expressing themselves clearly. One of the main reasons for communication difficulties in the final stages of life is physical weakness. As the body weakens, so do the muscles necessary for speech. This includes the vocal cords, tongue, and lips, which play an essential role in forming words and sounds. When these muscles no longer function effectively, speech may become softer, slurred, or even completely unintelligible. In some cases, the person may lose the ability to speak entirely, leaving them with limited ways to express their thoughts. Additionally, mental confusion can contribute to communication difficulties. Conditions like dementia, Alzheimer's disease, or other cognitive disorders are common in older adults and can severely impact their ability to understand and process language. These conditions may make it hard for a person to follow conversations, retrieve words, or form coherent sentences. As a result, their speech may become fragmented, with words out of place or unrelated to the context. This confusion can be distressing for both the person and their loved ones, who may feel frustrated or helpless when trying to maintain a meaningful conversation. On the other hand, the emotional and psychological strain caused by approaching the end of life can also hinder communication. People often become more reserved, whether out of fear, sadness, or simply the desire to conserve energy. The fear of becoming a burden or the difficulty of accepting the inevitable may cause someone to withdraw from conversations, even with close family members or caregivers. In some cases, the person might have trouble expressing their needs or desires, leading to frustration and isolation. In these situations, it is crucial for caregivers and loved ones to be patient and understanding. Even if the person can no longer communicate verbally as they once did, there are still ways to connect. Nonverbal cues, such as body language, facial expressions, and gestures, can provide valuable information about how the person feels. Furthermore, maintaining eye contact and speaking in a calm, reassuring tone can help the person feel more comfortable, even if they cannot respond verbally. It is also essential that caregivers advocate for the person's well-being and comfort, even when communication becomes challenging. This may involve paying closer attention to their physical and emotional needs, providing assistance with daily activities, and ensuring they receive appropriate care. In some cases, medical interventions may be necessary to address underlying conditions affecting speech and cognition, such as infections or medication side effects. Ultimately, while difficulty communicating is a tough and often heartbreaking signal of the end of life, it should not be ignored. By recognizing and responding to this signal with compassion and care, loved ones can ensure the person receives the support and comfort they need during this difficult time. If you find these stories inspiring and motivating you to take action, please comment 9. If not, comment 0. Your opinion means a lot to us. Thank you for your valuable time. Signal number 11. Unexplained weight loss. Unexplained weight loss is one of the most concerning signals that the body may be approaching the end of life. While a decrease in appetite is a clear and common sign in older individuals, rapid or unexplained weight loss can be a more alarming indication that something more significant is happening. This sudden weight loss may be a warning that the body is beginning to deplete its energy reserves, which could signal that vital organs are starting to fail. When the body starts running out of its natural energy reserves, it begins to use fat and muscle to sustain essential functions. This process is a normal part of aging in many people, but when weight loss occurs quickly or without a clear cause, it may indicate that the body is struggling to survive. This could suggest that organs responsible for digestion and nutrient absorption, such as the liver, kidneys, or intestines, are no longer functioning optimally. One of the most concerning aspects of unexplained weight loss is that it often goes unnoticed in its early stages. The gradual nature of decreased appetite or energy may lead many people to believe it is simply a part of aging. However, when weight loss becomes noticeable, it can be a signal that the body's ability to sustain itself is deteriorating. For example, a person who previously maintained a healthy weight may find they are losing pounds without changing their eating habits or physical activity levels. This can lead to a weakened immune system, making the body more vulnerable to infections and other diseases. Furthermore, unexplained weight loss can have a significant impact on a person's overall health and well-being. As the body loses muscle mass and fat reserves, it becomes harder to maintain strength and energy levels. This can lead to fatigue, weakness, and a reduced ability to perform daily activities. In some cases, the loss of muscle mass can also contribute to joint pain and mobility issues, making it more difficult for the person to move or carry out basic tasks. It's important to note that unexplained weight loss doesn't always indicate someone is nearing the end of life. It can also be a sign of various medical conditions, such as cancer, thyroid disorders, diabetes, or gastrointestinal problems. Therefore, it is crucial to seek medical attention if rapid or unexplained weight loss occurs. A healthcare professional can perform tests to identify the underlying cause and recommend appropriate treatment options. In some cases, unexplained weight loss can be managed or even reversed with medical intervention. Nutritional support, such as introducing calorie and protein-rich foods or supplements, can help restore lost weight and improve overall health. Additionally, treating underlying conditions contributing to the weight loss, such as infections or metabolic disorders, can help stabilize the person's condition and enhance their quality of life. In conclusion, unexplained weight loss is a serious sign that should not be ignored. Whether due to the natural deterioration of the body or an underlying health condition, it serves as a warning that the body is in distress. If you or someone you know experiences rapid or unexplained weight loss, it is important to consult with a healthcare professional to determine the cause and take steps to address the situation. Early intervention can improve outcomes and ensure the best possible care for the individual. Signal number 12. Appearance of spots or rashes on the skin. The appearance of spots or rashes on the skin can be one of the alarming signs that indicate the body may be approaching the end of its life. As the body ages and undergoes various changes, it sometimes becomes less efficient at eliminating toxins, and circulation can slow down. These changes may manifest as dark spots or rashes on the skin, which can be noticeable in different areas of the body. These skin issues often occur when the body can no longer function as efficiently as before, leading to a buildup of waste products that affect the skin's appearance. The formation of dark spots, known as age spots or liver spots, is a common phenomenon as people get older. These spots are usually the result of prolonged sun exposure or the body's inability to break down and eliminate excess melanin, the pigment that gives color to the skin. Age spots are generally not dangerous, but their sudden appearance or an increase in size could indicate that the body is having difficulty with circulation or detoxification. In more severe cases, people may also develop rashes or red patches on the skin, which could be a sign of underlying medical conditions such as infections or organ dysfunction. These rashes may occur due to the skin's inability to effectively expel toxins from the body. As circulation slows down in the later stages of life, blood flow to the skin decreases, leading to a buildup of waste products in the tissues. This accumulation can cause the skin to develop various spots, rashes, or even ulcers. When the body is no longer able to eliminate toxins effectively, they can remain in the bloodstream and deposit in the skin, causing visible changes. It is important to pay attention to these skin changes, as they may indicate that organs such as the liver or kidneys are no longer functioning properly. However, it is also important to recognize that not all skin changes are immediate causes for alarm. In some cases, age spots and minor rashes are simply part of the natural aging process. The skin becomes more sensitive with age, and it is common for older adults to develop dry skin or small rashes that are not related to serious medical issues. It is also possible that the skin may show signs of irritation or minor allergic reactions that are not linked to life-threatening conditions. Nevertheless, if the appearance of spots or rashes is accompanied by other symptoms, such as pain, fever, or unexplained fatigue, it is essential to seek medical attention. A doctor can determine whether these skin changes are the result of an infection, a chronic condition, or a sign of a deeper problem related to organ failure or circulatory issues. Early diagnosis and appropriate treatment can help manage these symptoms and prevent further complications. In conclusion, the appearance of spots or rashes on the skin can be a sign that the body is experiencing difficulties with circulation or detoxification. These skin changes may indicate that the body's systems are no longer functioning as efficiently as before. While some skin issues are simply part of the aging process, it is important to remain alert and consult a healthcare professional if you notice sudden or significant changes. Addressing these changes early can improve overall well-being and ensure that any underlying problems are managed appropriately. As we approach the final stages of life, it is crucial to recognize the signs the body sends us, as they can help us prepare and make informed decisions. The 12 warning signs we have mentioned are just some of the ways the body signals that something is changing. If you notice any of these signs in yourself or a loved one, it is important to act quickly and consult a doctor to receive the best possible care. We should not face these moments alone, and it is vital to seek both emotional and physical support. Remember, health and well-being should always be a priority, even as we approach the final stages of life. If you found this video helpful, don't forget to like, share it with those who may need it, and subscribe to our channel for more content related to life, health, and well-being. Thank you for joining us.